when I have to start to do something with that memory. So now I have to start to process that memory more. So when we look at working memory tasks, as I'm trying to write something, I'm thinking about what I'm going to write, and I'm trying to bring up some past experience so I can write about that. And this last one on this list about autobiographical or episodic memory, it really gets into our ability to not just talk about the facts, but to really talk about the emotions and the feelings and all of the characters who go into our life. So when you ask some people, they will say, some people with autism will say, well, this is what I did this weekend. And then they'll just give a bunch of facts. And when we ask them who they did it with, they may not be able to tell us because they can't really remember the characters really well. When we ask how they felt about it, they may struggle with that because they didn't integrate the feeling with the facts. Now, as I said, the other areas, really as we look at them, the areas of memory that are struggled with most are really around the ability to do more complex processing of information for memory. Now we're going to take a second to talk about language. And language with autism spectrum disorders can be quite a complex thing to talk about. Initially, the differentiation between autism and Asperger's syndrome was really around, did somebody have language skills and did they ever have a language problem? I think we've started to move beyond that. In fact, I've heard that we will be moving in the DSM-5, we'll be moving to a more broad autism spectrum disorder category, and Asperger's syndrome will really come underneath it. And the reason for that really gets into this slide, and that is for many people with autism, they have pretty good basic grammar skills. And again, just as a reminder, we are talking about high-functioning individuals with autism and Asperger's syndrome right now. Now, there is this tendency towards formal or pedantic styles of speech, and in fact, one term that has been used is the little professor. They may have very formal speech, and in fact, at times, family members and teachers may be very impressed by their grasp of grammar. Unfortunately, they may have more difficulty with reciprocity or taking into account the other person during interactions. This is the complex nature of language for some people with autism, because what they're really getting into here is this concept of having good language, but not necessarily using language in a very efficient social nature. Now, some of the difficulties that have been noticed really get into the areas of complex patterning or complex reasoning around language. And when you look at this particular list of language difficulties, what I really want to focus you on is that really as you're looking at this, it's that ability to integrate multiple pieces of information. So for example, let's take the first one, voice quality and intonation. Really what voice quality and intonation get to is the rise and fall of my speech and how important that is for another person to be able to tell what I mean when I say a particular thing. So when we look at voice quality and intonation patterns, we both see problems with the ability to express voice quality and intonation. So we may see unusual or atypical rise and fall to speech, or we may see a very monotonous pattern for some speech for some people with autism. We may also see some abnormal pitch patterns. And in fact, I've seen individuals whose voices are very, very low, And I've also seen individuals whose voices are very high. They may have problems with volume and voicing, so they may be very, very loud or quite soft. And they may not be able to read the context of the social situation to be able to tell what loudness of voice really fits right now with what I want. Now, they may also have pragmatic impairments. In fact, pragmatic impairments are probably one of the most common things we see. When we look at pragmatic impairments, we're really getting into the dynamic social nature of language. Language is not something just to exist in my own head, but it's something that allows me to interact with others in my environment. And I want to be able to go back and forth. I want to be able to have this reciprocity. And one of the more, I guess, classic things that we'll see with some people with autism is this tendency to violate pragmatic rules. And again, pragmatics are the social nature of language. So they may have some bizarre utterances at times, or they may assume you have information that as a listener you don't have. So you may find yourself confused by what the person with autism is saying. They may also dominate the conversation, so they may not take turns back and forth. They may have very rote speech, so they have routines and rituals around how they interact with others. Now, this is a study of sentence comprehension that was done. I wanted to include this here because what I wanted to show is that it's not just that we see behavioral patterns, but there are differences in the brain for some people with autism. And what is, I guess, what I want you to get out of this slide is really that the person with autism might use a very different way of brain activation to do the exact same task. But they may not use as an efficient of a system. And in fact, there may not be this kind of synchrony or harmony between activations of different part of our brain than for the more neurotypical individual when it comes to doing certain tasks of reading. So they may do quite well in decoding, and in fact that we'll talk about that in a few minutes. That can be a strength for many people with autism, is decoding. But they may have difficulty actually activating the parts of their brain that would allow them to, again, do this kind of whole interpretation of what they've been reading. So while they're able to read it, they may not be able to understand or comprehend it. Now we're going to move into abstract language. And abstract language, one of the more classic interpretations for some individuals with autism is that they tend to be literal in their interpretation. They tend not to see the abstract nature of language. And so they may struggle when language doesn't tell them or doesn't mean the exact same thing that it says. So jokes are a common difficulty. Sarcasm, and sarcasm is something that some individuals or some people with autism may be prone to sounding sarcastic, and so people in their environment may use sarcasm with them. The person with autism might not understand that. They might not understand the sarcasm, and in fact, they may become agitated and upset because of the use of sarcasm, because they may not be meaning. The sarcasm that we hear in their voice may be this atypical pattern of speech or intonation, and it may not be an intentional use of sarcasm as a more neurotypical individual might use it. Now, there may also be some challenges with abstract thinking. And when we think about abstract thinking, we're really thinking about how do we use this abstract language to think about the world. And so this is really what social interaction is all about. Social interaction is all about abstract thinking. It's really all about figuring things out and not necessarily just using what somebody says, excuse me, but also using our knowledge of the individual. So if someone comes up to me and they say, I ask them how they're doing, and they say, fine, and I look at them and I know them and I see their face, I may say, oh, you know what, this person isn't fine, they're actually quite upset right now. Some individuals with autism will have difficulty doing that because that's really an abstract thinking task. It requires me to really take information and play with it in my mind and use past experience to really make judgments about what's going on currently. Now we're going to talk about social cognition for a moment, and this is a quote from Daniel Goleman in his book Social Intelligence. And social cognition is really knowing how the social world works. It's being able to think about the world socially. Now, in studies of people with autism, there may be some difficulties with multiple different areas of social cognition. Of particular interest to me here is that they may struggle with some of the nonverbal areas of social communication, which when I look at social cognition and social communication, really much of what we use to signal to one another is nonverbal. So we're really looking somebody's face, and when we see them pause, even when we hear them, the facial expression and their body language, that really tells me that, you know what, they're ready right now for me to start to talk, which is important in this concept of turn taking, that I'm really noticing the signals in the other person, that right now they're ready for me to talk. If I'm not aware of their nonverbal cues, it's going to be very hard for me to be aware that right now they're done talking and it's my turn. In fact, I may have unusual pauses in the conversation, or I may just start talking over the top of them. Now, we'll also see for some people some difficulty with empathy, but it's not that they don't feel empathy. They may not demonstrate it, which is a pretty, I think, complicated thing. But it's not necessarily that they don't feel for another person, but they may not be able to demonstrate this to another. So they may not be able to really show this other person, even if they do feel it. Now, we've already talked about the difficulties for some individuals with autism with understanding others' thoughts, feelings, and predicting others. But I want to talk about personal space for a second, because personal space is really something that in many ways we take for granted. Neurotypical individuals, in fact, will often violate the personal space of people with autism without even being aware of it. And then we will become upset when an individual with autism violates our personal space. And what this gets into is that there really are some complex dynamics around personal space for some people with autism, particularly high-functioning autism again. When we look at personal space, I may need more personal space around me if I'm a person with autism, because I can't trust the sensory stimuli. It may be just too much for me, and I may have some hyper arousal to touch stimuli. At the same time, I might walk right into another person's personal space and violate that because I want to talk to them. And it's okay, again, as the person with autism, it's okay because I'm the person doing it. It's not okay when somebody does it to me. This may be a skill that needs to be overtly taught, and at Lionsgate we have focused in the past on the use of boundary circles to help teach some of this personal space boundary.